just as parents are preparing to send kids back to school. According to the U.S. Department of Health and Human Services, more than 1,900 kids are currently hospitalized with the coronavirus as of Saturday. This comes as children under the age of 12 remain ineligible for vaccines nationwide. In Louisiana, one pediatric ward is seeing a record number of cases and hospitalizations among children, some even as young as a few weeks old. For more on this, we want to bring in Dr. Mark Kline. He is the physician-in-chief of Children's Hospital New Orleans. Dr. Kline, thanks for joining us. What are you seeing right now in your hospital?
Thanks for having me on this morning. We are seeing a lot of cases of COVID in children. This is really, this Delta variant has been a game changer for us. We did not have very many children ill enough to be hospitalized during the first year of the pandemic, but over the past really 4 weeks, we've seen an explosive growth in the number of cases. The rate of COVID-19 among outpatients is now at about 25% here in our setting. And today we have 13 children in the hospital with COVID-19. 8 of those are in the intensive care unit. 3 are on mechanical ventilators. 1 is on a procedure known as ECMO, where the blood is circulated outside the body to support a failing heart and lungs. And so these are very ill children, and the Delta variant seems to be making children more ill than the earlier variants of the virus that we saw before.
Do some of these children who are hospitalized in the ICU have underlying conditions like asthma?
Some do. It's about half and half, Lauren. Some of the kids have no underlying conditions. They're perfectly healthy otherwise, and they've fallen ill with COVID. And some do have underlying conditions, often subtle. It may be something as simple as asthma or obesity or diabetes, but most of the kids are generally healthy until they fall ill with this virus.
Have you gotten a chance to speak to the parents? Have they said that they were taking precautions to keep their children from getting sick, wearing masks, anything like that?
You know, it's variable. Here in Louisiana, only about 37% of adults have been fully vaccinated against COVID. Only about 13% of adolescents, by the way. So we're well below the national averages on both counts. And when the children are admitted to the intensive care unit, sometimes the parents tell us that they've been vaccinated and sometimes not. One thing that is very clear is that these children that are falling ill are doing so because of exposure to unvaccinated adults. It's the unvaccinated adult population that really is driving this pandemic.
Yeah. As a mom of 2 young boys, this is really scary stuff because both are not eligible yet to get vaccinated. I was wondering, Dr. Kline, there is reporting that hospitals across the state are at capacity. But what other challenges are you seeing as doctors and nurses treat COVID-19 patients?
Well, certainly the adult hospitals across Louisiana have been at capacity for several weeks now and even beyond capacity. We've been very full. We were dealing with an epidemic of another respiratory virus, RSV, for a few weeks before this COVID surge began. Fortunately, RSV has abated some, and that's given us a little bit of a break as we've seen the COVID numbers rise. I'm quite concerned that with the start of the school year, we're going to see additional cases coming out of the schools. And I'm also worried about flu season, which is on the immediate horizon. We had a very light flu season last year. This year is likely to be pretty rough, and I think because of vaccine fatigue, it's going to be harder than ever to convince parents to have their children vaccinated against influenza. And so I just shudder to think what things could look like at our hospital and others over the course of the winter if we're dealing with a COVID surge as well as influenza at the same time.
Well, we have been reporting that several schools across the country have put in place mitigation efforts to keep students safe. Mask wearing is one of them. Is it enough, or do you think there's more they can do than socially distance their students and have them wear face coverings?
You know, we're really fortunate here in Louisiana. Our governor, John Bell Edwards, put in place a mask mandate 2 weeks ago today, and it covers a number of indoor spaces, but it does include schools. And so the mandate says that all school children 5 years of age and older, as well as teachers and staff in the schools, must wear masks. Masks are the best mitigation strategy we have right now, and they're quite effective at preventing transmission of the virus in the schools. You know, there's been all of this debate around whether children should go back to school with masks or without masks, but the only strategy that makes sense from the standpoint of keeping children in school, in other words, not just getting them back to school, but making sure that once they're there, they're able to stay and their education isn't interrupted by quarantine or by school closures, is masking. And masks are very effective. What's ultimately is going to get us out of this pandemic is vaccination, and all eligible adults and adolescents should be vaccinated. But as an interim measure, masks are very effective, and so we strongly believe that all children and teachers and staff in the schools should be wearing masks.
And just going back briefly to the children who are in the ICU at your hospital and what you're seeing the Delta variant do to them, how does it ravage their bodies differently compared to adults?
What we're seeing with this Delta variant is very similar to, I think, to what the adult physicians are seeing. It's primarily a respiratory illness.
Okay.
In the first year of the pandemic, when we occasionally did see children who were ill enough to be hospitalized, they often were ill with abdominal pain or diarrhea or vomiting or severe headache, sometimes with respiratory disease as well. But right now we're seeing predominantly respiratory problems. That is really what lands children in the hospital, and it makes them ill enough to be admitted to the intensive care unit. And that's a pneumonia-like picture with low concentrations of oxygen in the blood and respiratory distress. And sometimes the children require high concentrations of oxygen, and then in the most severe cases, they require mechanical ventilation or ECMO.
So what would you say to parents of children, especially under the age of 12, who cannot get vaccinated here in the U.S.? What would you say they should do to keep their children safe?
Yeah, that's an important question. You know, when you stop to think about it, the only population in the United States today that is 100% unvaccinated is children under the age of 12 years. They've not had an opportunity to take a vaccine. So as responsible adults and as a society, we've got to use a layered approach and actually cocoon them to keep them safe. And that includes the tried and true mitigation methods, masking first and foremost, but good hand washing and social distancing as well. But then those children need to be surrounded by adults who've been vaccinated. Everyone in their environment should have been fully vaccinated so that they are very unlikely to come in contact with an unvaccinated adult. That's what is really driving this pandemic at this point, and it's what makes young children the age of yours, so vulnerable right now.
So, Dr. Kline, are you for the idea of children under the age of 12 returning to school?
I am. I do think that in-person learning is superior to the remote learning that we've had over the past year and a half or so. But it has to be done with the proper precautions in place. You know, certainly the schools have an obligation to educate our children, but they have an obligation to keep them safe as well. And sending kids back into a school environment where you congregate 25 or 30 children in a classroom with the rates of COVID that we're seeing in our community right now, that's a formula for failure. Very predictably, you'll see clusters of cases, you'll see dozens or hundreds of children on quarantine, and you'll see school closures. And that's not to the children's benefit or anyone's benefit. The only strategy we have today to get children back to school and to keep them in school and to make sure that their learning can be done continuously and in an uninterrupted fashion is universal masking in the schools.
Dr. Mark Kline, thank you.
Thanks so much.